Good evening, everyone. Thank you for joining the right time. My name is Gerald Otieno, an environmental health student at Pwani University, finalist. I'll take this time to say that I'm honored to truly present in this global gathering today. I'll take us through my research that is titled Utilization of Health Services Provided at Pwani University. When you look at the script, it is recorded that I'm investigating effectiveness, accessibility, and barriers to healthcare services at Pwani University Health Unit. That is because those were my objectives. So welcome to this presentation. This is the background. This is the outline of our presentation, my presentation today. I hope all of us, we can see it. The brief.
Yes. Okay.
Okay, thank you very much. This is the outline of my presentation today. I'll start with a brief discussion, background of the study, the problem that I identified. You can see the objectives and my research questions, the importance of this research, conceptual framework, the study approach or methodology, and my work plan, and lastly, acknowledgements. Brief background of my study. Access to health services is critical to all of us, especially for vulnerable communities, populations, such as students. This is as highlighted by WHO, World Health Organization, 2020, that regular access to healthcare improves disease prevention, early diagnosis, and even academic performance of students. This is, unfortunately, this is not a deal because the barriers such as poverty, stigma, infrastructural gaps, as cited by Crook, that is 2018, a study that these factors, or rather these barriers, limit access to health services. This is more so in the low and middle income countries, just like Kenya or sub-Saharan Africa. Next slide is, yes. Here is problem statement. Despite the availability of services at Pwani University Health Unit, it realized that many students are reluctant to seek these services, and this would lead to some preventable health complications. These would be due to now barriers such as lack of awareness, stigma. This stigma now, especially mental lack of seeking mental health support, and such cultural preferences that necessitate or compels the student to prefer self-medication. There is limited and sufficient data on the patterns and root causes of this and utilization of health services. Now the study will examine the barriers and actually propose solutions to improve these health services. Now here is my the research objectives. And objective number one, this research is to assess the level of accessibility of health services provided at Pwani University Health Unit. Second objective of this study is to evaluate the efficiency and effectiveness of health services. This is in terms of service delivery. Objective number three is to investigate the frequency of students on utilization of health services at Pwani University. Number of visits of students at Pwani University. I find these objectives are all aligned directly to a number of sustainable development goals. But here I have highlighted only two, that is number 3, good health and well-being. Number 4, that is quality education. With that, with objectives in mind, here are the questions that I formulated now. Question number 1 is how accessible are the health services at Pwani University Health Unit? Question number 2, what are the factors influencing the efficiency and effectiveness of health services at Pwani University? Or rather, what are the barriers to health service utilization? Number 3 question is, what is the frequency of students on the utilization of health services? As you can see, these questions are formulated just directly from the objectives that this study is supposed to achieve at the end. This study is important because it addresses the gaps in health service utilization. Health service utilization, remember, these impacts both physical, mental, academic performance for students, long-term health outcomes, is according to WHO 2020. My study would offer valuable insights to the Pwani University administration, to the health professionals there, and most importantly, I will go beyond Pwani University and across Kenyan higher learning institutions to guide policy-making processes in our healthcare systems. The next slide, as you can see, this is a visual representation of the conceptual framework, just to make us understand how the independent variables together, the relationship between the independent variables and the dependent variable. So these individual factors, behavioral factors, and health service factors, together we can term them as we have enabling factors, we have need factors, and predisposing factors. All these factors interact together to shape up the health service utilization, as you can see, as our dependent variable. Next slide will show our methodology. I adopted descriptive cross-sectional study.
Gerald, you have 2 minutes.
Okay, thank you. Descriptive cross-sectional study design among Pwani University undergraduate students in this academic year, 2024-2025. This would be effective through stratified random sampling of 368 students. On data collection, structured questionnaires via Google Forms are used. Because this is an ongoing research, I'm using the structured questionnaires via Google Forms. Now, at the end of data analysis, We compile this data in Excel spreadsheet together with SPSS software that is often used for collection. Without forgetting ethical standards of my research, I sought clearance from Pwani University's ethics review committee and from the National Commission for Science, Technology, and Innovation. That is a national commission that ensures ethical standards are upheld. This slide, you can see this is my work plan. This is the timeline that is structured carefully across proposal development, submission to ethics review, cross data collection and analysis, and final presentation of this project to the university.